Morning to expand on the program is California GOP Congressman Devin Nunes, ranking member of the House Intelligence Committee, member of the House Ways and Means Committee. Congressman, thank you so much for joining us this morning. I wish you a happy Palm Sunday. Difficult times for all of us. You know, the president yesterday at the podium, you heard what he had to say about looking forward. He's also tipping his hand at possibly creating a second coronavirus task force to look into the reopening of the economy. How do we balance right now this idea that we're fighting a pandemic, but we also have a wave of economic data showing us that we're in a world of hurt? Where should that balance be?
Well, it's a real struggle because this has never been tried before. We've never actually unplugged an entire economy. And don't forget, it's almost an entire global economy. So clearly things have to happen. I've been on the phone with the White House, with professionals, and I think one of the most important opportunities that we have as we look forward, and I'm quite positive on it, is that if we can get the blood test that can test whether or not an American has had this in the past, so that we actually would know, those of us that have been exposed to this, because we know this virus is extremely contagious. But remember, because we didn't have the tests at first, right now the doctors are still trying to only test the people that are showing symptoms. But what we know from the past is that there's a lot of people who don't show the symptoms. So one of the optimistic things that we have on the horizon here is if the approval of the tests where people can take blood tests, those people then can go back out in the workforce. And I'll also say, before I turn it back, is that, I'm in an agricultural region, and we can't stop. We have animals that have to eat. We have plants that have to be tended to. So a lot of folks in the San Joaquin Valley, which is that big valley in the middle of California, our folks are going to work 7 days a week, 24 hours a day to make sure that people have an abundant food supply in this country.
I do think that test is going to be critical to determining when we're able to, start getting the economy, get it back on track, start getting people back to work. Do you have any indication of how far away we might be from that?
Well, look, it really is the difference between what are the hot spots and what are not, right? So it's going to be the president has been pretty clear that he wants the governors to decide. And I think that's best. I think you could even do it at the county level, would maybe be even better, or the city level, and let the local politicians and the local doctors that are monitoring the situation on the ground. Because remember, we're testing right now, we're going to have a lot more people that are going to test positive. There is no question that, because once you end up in the hospital, it's not very promising, and we don't have all that data yet. But the preliminary data that's coming out doesn't look good. That once you get to the hospital, your chance of survival is fairly low. Now look, but if you never go to the hospital, your chance of survival is extremely high, and that's the concern. I would say that the elderly population, especially in some of these group homes, just continue to stay away from those folks. Let the healthcare professionals go in there. That to me could be where we could have some hot spots in the future.
Hey, Congressman, I want to turn to another population. Doesn't get a lot of attention necessarily, and that's the homeless population. Obviously very much at risk. You had a problem in California even before coronavirus. Now it's worse. I understand that the governor of the state looking at making some 7,000 beds available. We just had in the last hour Jake Wood from Rubicon setting up some facilities to try and help triage that situation as well.
So the situation out here in California with the homeless population is quite dire. That was before the coronavirus. It's almost like zombie apocalypse. If people you've seen the pictures. I know you guys have showed this on Fox News about San Francisco and Los Angeles. But you have to understand, I've got several thousand just in my district. So the homeless population is spread across California. It's largely due because we let our criminals out. So we passed laws that let multiple convicted drug abusers out. Now, look, unfortunately, a lot of these people, I call it zombie apocalypse because a lot of these people have done drugs for a long period of time. They're just not, they're not well. Now, one of the advantages has been we have picked up a few folks that have tested positive for COVID. But one of the positive things if in all this is that if you're outside in the outdoors, you're social distancing. We haven't seen it run through homeless population, at least that we know of yet, like we've seen, to my earlier point, about in these group homes with older people that have underlying health conditions.
Congressman, I want you to look into something for us, though, because it makes no one's going to disagree with your point there. But when we talked with Jake Wood, a Marine sergeant veteran who's trying to help this effort here, he says he's running into bureaucracy problems in your state. Listen to this, and I want your reaction.
We have 33 personnel on scene right now. We've set up a 250-bed federal medical station. Unfortunately, we continue to run into the buzzsaw of bureaucracy, and this isn't just Santa Clara. We're seeing this throughout the country.
Congressman, Team Rubicon trying to help, and they can't.
Yeah, we had something similar. I don't know where the location. Remember, California's a big state. But we had something very similar on our emergency plans that we have submitted to the state that have been on the books for 15 years. We wanted to use the local fairgrounds. It's a large facility, several hundred acres, lots of buildings spread out. FEMA gave us 250 beds prepared to go. I'm just talking about in my region. And then lo and behold, the state came down and said, well, you're not going to use that facility. And so then our local officials had to scramble to get another facility. So I understand the frustration. The good part right now is that very few people that get infected have to go to the hospital. Let's hope that trend continues. We have a lot of available space right now, at least in California. And in fact, we have so much available space that I'm talking to a lot of our local healthcare providers. They're having to lay people off because kind of your typical people that may come in for surgeries or have a heart issue, all of those issues are being put off. These long-term chronic care issues are being postponed, and we're laying off health workers in some cases right now.
So interesting how this can be.
We got to get through this.
Yeah, how this impacts different places so very differently, and you laid that out nicely. Exit question here. You're talking about how things are different locally. Well, there's been a federal response with a third bill that came out, $2 trillion, which is being spent right now, a lot of which is going to small businesses. Yet there's talk of a fourth already. We've had guests on the program that suggest it's necessary if we want to see a huge comeback when this is all said and done. You're as plugged in as anybody on Capitol Hill and into the White House. What's the thinking right now about these bills?
Well, if you look at the big picture, it really depends on when we go back to work. And that's why I think the president's talking about it. I've been saying it that, the faster we can get people back to work, the better off we're going to be, because as we started out with, the economy's been unplugged. If you look at it in the macro sense, these are just rough numbers. For every month and every 10% that we're down in GDP, we have to plug in about $500 billion into the economy when you have an economy unplugged per month, per 10% of GDP. Now, those numbers are now fluctuating anywhere from that we're going to be down 10% this month to 40% this month. I don't know where that comes out at, so I think we have to judge by when do we get back to work and what does our GDP numbers look like after we get the data.
If I can ask you this real quick before we go, when initially it was 15 days, to stay inside, to social distance, to do your part, to flatten the curve, and then it was 30 days. What is your expectation and what are you hearing? What's the conversation like about how long realistically we're looking at doing this?
Well, look, I remain optimistic. I don't know. I think it's going to have to be, basically let down to the county level, city level, governor level. If you look at the best opportunity we have right now, and you mentioned it just a little bit earlier, if we can get these tests off and running, there's about 20 or 30 tests sitting at NIH and CDC that they may approve that protocol now to go out and test the population. Imagine if all of us can get tested quickly to whether or not we have the antibodies or not. And I think that's going to be the key to getting this country back to work and how many days we have to stay inside.
All right.
I agree.
Congressman, thank you very much.
Thank
Appreciate
you.
your time.
My pleasure.
Thank you, Congressman.
Have a great Palm Sunday.